Hi, I'm Naisha McCauley, and you're watching accesstv.org.
Well, many reasons health equity is important, but I think for the work of the Commission and my role in the Commission, the fact that health disparities and paying attention to health disparities and the work that we do is about looking at different outcomes, better health outcomes for what we know is a disproportionate amount of chronic disease and mortality, especially here in the state of Connecticut. And that as more we focus on that, the better health outcomes we can expect to see.
Equal access to health care is a moral and ethically right thing to do. In the supposedly most enlightened and richest country in the world, it is a disgrace that we still have such inequity. Just as there is unequal distribution of wealth, I think it follows that too few people have fair and reasonable, culturally competent access to health care, and I just think that's immoral.
Health equity is very important because it's a basic need. It's a right that every single human being in the United States should have. If we are a country based on freedom, we should be able to make sure that each of our families and individuals has quality health care.
It's a burden on all of society. It follows naturally that if a certain segment of the population suffers from preventable or treatable diseases, mental health addictions, medical conditions, then the burden is spread equally among all of us. And so it really only makes sense for there to be a more equal distribution.
Health equity is very important to me because even though I have a white complexion, my family were immigrants and came to this country from other places. I grew up poor, as many of the people who we serve in our organization do. But I think health equity is something that many people are not aware of, does not exist. They don't know about the disparities, and being a nurse for over 44 years, it's something that I've seen many, many times in my life. People don't know that people of color and people with accents don't even get offered the same care that other people get, and I don't think that it's an intentional thing. I think it's perhaps a subtle bias that occurs, and I think that's an important role for this commission.
Well, since I represent the Department of Correction here on the Commission for Health Equity, I believe that since we have racial and ethnic minority groups having a disproportionate amount of health equity issues of chronic disease and mortality, and the Department of Correction houses a disproportionately higher rate of racial and ethnic minorities, specifically Hispanic and African American, that we have an opportunity on our hands to address something that is simple, what is modifiable and preventable, that we know it. So through education, I believe, about modifiable and preventable risk factors among our racial and ethnic minorities is what I advocate for the most.
My agency, the Permanent Commission on the Status of Women, is concerned with gender, with unequal access to all kinds of services, especially in healthcare. Women are systematically discriminated against in healthcare premiums. We pay more for the same medical care. We pay more for long-term healthcare insurance because we tend to live longer. So we are penalized, actually, for taking better care of ourselves. The other piece of this is that too few clinical trials are devoted to women's particular health needs. Everybody can name, for example, the symptoms of a heart attack, chest pain, elephant on your chest. That's not what women experience at all. Women have nausea, they have a sense of dread, they have lower back pain. So even EMTs often will misdiagnose a woman's heart attack as something else because they're just ignorant of the actual difference between male and female symptoms. So we would advocate for greater money to be put into how certain drugs and clinical practices affect women specifically, education programs for prevention for women, and to eliminate the discriminatory practice of charging women more for health care coverage.
Well, I advocate for many things. I advocate for women's issues, and I think this might be a good point to say that health equity and advocating for health equity is not just people of color and people with accents and people from different cultures, but that it's women, it's seniors, it's people with special needs, people with gender identification issues, and these are all issues that I fight for and have fought for many, many years, and that's why this is so important to me.
Our commission, which is the Asian Pacific American Affairs Commission, and we are part of the Commission on Health Equity, we advocate for underserved populations. We want to make sure that every community is able to access health care, quality health care, and be able to address any of their basic needs, whether it's medical, legal, anything else. So it's really about trying to assist communities in empowering themselves and being able to improve their quality of life.
Hi, I'm Dr. Helen Newton. The voices you just heard are ones of the Connecticut Commission on Health Equity. Our mission is to address disparities in healthcare based on race, ethnicity, gender, national origin, and linguistic ability. Our goal is to not only shed light on these disparities, but innovate and improve upon them, making quality care accessible to all, regardless of status and need. We believe that quality health care is a right, not a privilege, and we will work hard to get the resources to help implement policies that will close the gap between the status quo and quality care based on individual needs. We work together with state and private agencies, along with the Connecticut state government, and of course you, to make this happen. We've made progress over the past 5 years and hope that by the end of this video, you'll help us do more.
Well, the Commission on Health Equity has been here for just a few years. This state of Connecticut has been trying for a long time to really focus in on what agency, what community representatives, what community agencies are responsible to reduce and eliminate health disparities, improve diversity, to work with all of the agencies, the hospitals, the state agencies, work with everyone to eliminate health disparities. So the Commission is the only organization, state organization, that has that as its mission and as its charge. I think that's the most of it.
Well, I am so honored to be on this commission. I had the honor of being on it right from the beginning, so I watched it grow and saw how we evolved our vision and our mission and our purpose. And the purpose of this committee is to help or this commission is to help other people in other organizations be enlightened on some of the issues that we've come to know. We're doing education. We're not only educating the people who provide services, but we're also spending a good deal of time getting feedback from people in the community about what the issues are as they see them. Forums, meetings, representing people in different groups. So all of this, I think, is a very important piece of this committee. I think the Public Voice Committee, which I'm chairing right at the moment, is the voice of the committee, and it's an opportunity to get information out to the public and out to the people who provide the services, to the people who are in our target groups, and again help them become more aware of the issues and perhaps relieve them of some of the burdens of things that occur perhaps subtly that they're not even aware of.
I think the most important achievement that the Commission has accomplished to date really has been taking a model that is used with our hospitals in the state, but taking a model and using this model with state agencies to eliminate health disparities, to improve health outcomes. The model actually has been started and taken from the United States Department of Health and Human Services through the Office of Minority Health. And that work started way back in the 1990s and has been progressing over the years, and to this point and today, and us being here today, to address the national class standards, culturally and linguistically appropriate standards to improve healthcare, health and healthcare. So the accomplishment is moving this process along and really taking that model and encouraging, because there's no penalty to do this, except going against some of the laws that are on the books. But really taking the model and beginning to work through each agency to help them to understand what the benefit is, what the value is, to eliminate health disparities, to assess the work that they have been doing, identify where the funds are going. Are the funds doing any good? If they're not, what are we doing about them? And help them assess and really carry on the work in a better manner.
The public forums that have been done throughout Connecticut and that are still continuing, and I think are reaching out in the next month to reach people through their faith-based affiliations, is going to be another important piece of this commission. The training program on the class standards is exceptionally important, and the fact that we're hosting it here and inviting other agencies should be a source of great pride to us.
About a third of the members of the commission are representing the commissioners of state agencies. Again, this is rather unique. And these commissioners with a small c, who sit around the table at the Legislative Office Building, are really engaged in working together. They're aware of the strategic plan that they have all agreed to. That strategic plan includes the class standards, addressing the class standards, and helping the state agencies to understand how to improve health equity and what the definition of that is. So the others who sit around the table who are members of the commission are from community-based organizations and individuals. But we're all trying to strive for, and this isn't the only organization, but we're all trying to help each other understand, again, the benefit of eliminating health disparities, at least working together to help eliminate health disparities.
I think the organization is representative of so many different people from so many different organizations and commissions across the state. And I think the fact that I've heard, and I believe this to be true, we're the only commission that reports directly to the governor. I think that gives us a very astute way to reach the voices that really matter. But I think that going forward and touching people in the commissions in which they go, are going and sharing time with the commissions, like the Latino and Puerto Rican Commission has held I believe it's 3 groups that several of our representatives have been at. We spread the word by being in different places and by speaking toward our vision and our mission and our purpose in those meetings.
Well, I think it's important for people to know that the law that established the Commission on Health Equity said and says that the equality in the attainment of the highest standard of health for all residents of the state is a human right and a priority of the state of Connecticut. It's important to know that, a human right and a priority for the state of Connecticut. And with that broad mandate, the Commission has the opportunity to really improve the health status of people within the state of Connecticut, and also, of course, to improve people's lives. So the Commission, through activities such as working with the public and informing them of the whole notion of health disparities, working with state government to try to improve the delivery of services in accordance with health equity principles, and things such as just going into people's churches and the community in specific that experiences health disparities, is making a change for the better and improving the health status of people in Connecticut.
I think primarily what the Commission has done, at least my involvement with the Commission, has we've been able to visit various communities and neighborhoods and individuals and let them know what health equity is. Basically informing the public about the need for them to understand health equity and how they can empower themselves to improve their life outcomes, their health outcomes. We've been able to give them information and also hear from them, which is, I think, very important. As a result, we've been able to help influence some legislation and bring to the attention of policymakers the issues that are out there that people are concerned about. I think that's very important, and it allows people to take control of their situations.
The public is extremely important to me because we are the public. The public is all of us. And I think chairing, well, I picked this committee as the very first committee that I worked on in the commission when it first started because it was an area that I felt was so important. But I think the Public Voice Committee of the commission is reaching out to so many people, and we're using information from our data committee, from our policy committee, from the other groups that work with us within our own commission, and taking that information out to other groups and commissions and spreading the word.
The public is everything that we do. Every policy, every decision, all the direction, we can't just make it up. We have to go with the lived experience. We pull from the advice of the people. We pull from the mother's voice. We pull from the employer's voice. We have to bring it from the ground, and it has to swell up. The most important thing about the public right now is making sure that we're actually there. So how we do this, we do it through public forums. We actually try to engage people who are more local level residents instead of just working with professionals. We actually go to the places where they are. We've had instances where we've been at Dixwell Avenue in New Haven. We're meeting at the mosque. We're meeting at churches. We're meeting you in the place where you are.
The community should trust us because we represent the face of the people across Connecticut. We have people of many cultures, many races, many religions, different ethnic backgrounds, different gender identities sitting in our committee. We represent children and seniors. We represent the justice system. We've reached out and tried to be very inclusive of people across our state, and I think that's why they should represent, that they should feel very comfortable in representing us. We may not all have their face or their language, but they'll find many people on our commission who do.
The community should trust us because we're nothing more than your neighbor. And this is the important thing to understand. We do work in this, but somewhere and something in us started us from a very young age and passionate about the work that we do. So we decided to go on this, we decided to represent the community in doing this, but this is a passion that we take from something that we maybe encounter from our youth, maybe something that impacts our families, and like I said, we're your neighbor. So we're just happy to be able to provide the service.
Thank you for watching. We hope this episode sheds some light on the Connecticut Commission on Health Equity and what we do. If you'd like to contact us, please email me at helen.newton@ct.gov. On behalf of everyone here at the Connecticut Commission on Health Equity, as well as our production team, I'm Dr. Helen Newton saying, so long and stay in good health.